Hi. This section will be the last lecture content for Lesson 6 and in the Occlusion in Dentistry course. The outcome for this section is that, upon completion of the lesson, the students must be able to discuss the different type and design of occlusal splints, and to understand more about occlusal equilibrium, when and how it can be clinically performed as part of the management of occlusal disorder. Nowadays, occlusal splints are commonly prescribed by the dentist to treat TMD or any orofacial pain. In treating occlusal disharmony, it is very important for us to understand how the occlusal splint works so it can be used effectively. The two categories of splint as been discussed by Dawson are 1. Permissive occlusal splint, a splint with flat and smooth surfaces that allows the muscle to move the mandible without any interferences from deflective contacts. 2. Directive occlusal splint, a splint that direct the lower arch into a specific occlusal relationship that will then direct the condyles to a predetermined position. The mechanism of action for splint depends on the type of splint. In this lesson, we will discuss the design of 4 different splint type: partial coverage splint, soft splint, stabilization splint and anterior positioning splint. For stabilization splint, hard acrylic covers the whole occlusal surfaces of an arch. The smooth surfaces allow the muscle to move the mandible without interferences, where the condyles can then slide back and up to the eminent, for a complete seating-eccentric relation. Indications for this type of splint are, patient who requires the reorganization to a new occlusion, or patient with parafunction habits. This will allow the mandible to find a comfortable position without deflective contacts, and rest the condyle in glenoid fossae. As a summary for occlusal splint, mechanism of action for each splint type will determine the clinical indication. The basis of their utilization is by understanding how the splint will affect the position and condition of the TMJs, and/or suppressive effect on the muscle activity. We will now go to the next topic, which is occlusal equilibrium. It has been suggested that following stabilization splint therapy, it is worth to consider occlusal adjustment, or occlusal equilibrium to avoid recurrent symptom from the deflective interference, or occlusal discrepancies. However, in certain cases, occlusal adjustment may become the first management to eliminate deflective contacts or interferences. As example, in the situation of over-erupted tooth or defective restoration occlusion. As a summary, occlusal equilibration must be planned after proper analysis, to ensure high predictability of the success. Any sign and symptom of occlusal disharmony can be eliminated after the equilibration, by knowing in certainty that the sign and symptoms is not associated with TMJ, and purely due to the deflective contacts of the teeth. We have now reached to the end of all lecture content in the occlusion course. Don't forget to go into the additional reading section, and finally to complete the assessment. Thank you.